Tina. Her mother has noticed some unsettling behaviors in Tina, including a dramatic reduction in activity, repetitive and purposeless actions, and immobility. She has called in Dr. Brott, a therapist, to diagnose Tina.
Hello, Dr. Brott. Hi, nice to meet you. Nice to meet you. So, over the past couple of weeks, my daughter has been expressing concern, and she's been having this strange behavior which is starting to scare me.
Okay, I'll take a look at her. Hi Tina, my name's Haley. I'm going to be your therapist. So I'm going to just see how she reacts to different stimuli. Okay. Has she been doing that a lot? Every time you move her, she just stays there?
Yes.
Okay, well this is called waxy flexibility. It's when patients, you can move them and they'll stay there and they'll stick. Has she ever started to get aggressive?
Yes.
So Tina, how are you feeling?
Feely.
Have you been taking any sort of medications?
Medication.
Do you like to do anything after school? What's your favorite color? Okay, after meeting with your daughter, I've seen that she's exhibited some strange behaviors, such as the waxy flexibility, as I explained to you before, where she moves her arm and it kind of gets stuck there. I've also seen that she's shown some negative symptoms, which means behaviors that should be here are not present in her actions. She's also unresponsive to the questions that I asked her. She wouldn't respond to me. And we call that a catatonic stupor, when the patients are just non-responsive, they give no interaction. She also has extreme resistance to movement, as every time I tried to move her, she would resist me in some way. Okay, and she also repeated words and sounds that I made, and this is called echolalia. Has she exhibited those symptoms?
Yes.
Yeah?
Yeah.
She also was mimicking the movements, when I tuck my hair behind my ear or move my arm in some way. She would repeat those too, and that's called echopraxia. She's exhibited those as well?
Yes.
So from what I've learned from observing your daughter, I believe that she might have catatonic schizophrenia. I'm not positive because I need to do more therapy sessions with her to actually see what other symptoms she expresses, but I would like you to come to my office tomorrow to see if maybe trying drug therapy would work, and so I'll explain more to you about that tomorrow and we'll see if that works.
Okay, thank you.
Okay, thanks for meeting me here today. I think drug therapy is the next step in treating your daughter to see if the negative symptoms can be reduced. I'm going to prescribe to her clozapine, and this is one of the most widely used antipsychotic drugs to treat these negative symptoms that she's experiencing. It's found to work in 85% of patients who do take this drug, so it's very effective. Although it is effective, it does have some side effects, such as tardive dyskinesia and drowsiness, nausea, weight gain, and because of these symptoms, I want to make sure that she's doing all right with the correct dosage and amount of times that she takes it, because it is different for so many patients. So I would like to see her in a week, and so she needs to take 2 of these for a week, and I would like to see you from there and see how it goes.
There is no cure for schizophrenia. However, there are several ways to treat the symptoms. Atypical antipsychotic drugs have proven especially useful when treating catatonic schizophrenia because they treat negative symptoms better than conventional antipsychotics. Atypical antipsychotics, such as the clozapine that Dr. Brott prescribed for Tina, work by blocking receptors for serotonin, acetylcholine, and histamine, which can dramatically reduce the appearance of negative symptoms. If Tina keeps up with her medication, there is a good chance that her symptoms will be reduced.
Hi, okay. I got your call during the middle of the week and I upped her dosage, and we tried, I think, another drug along the way, another antipsychotic drug. And have any of those been working?
No.
There was no change in her?
Nope.
She's still
the same.
the same. Okay. I think our next step might be trying electroconvulsive therapy, which is known as ECT. It's the next step after drug therapy if it's not working and there's no changes. So I want you to meet me at the hospital next week, and we'll get started on those therapy sessions and see if that therapy will be the best for her.
Okay. Thank you, doctor.
Okay, Tina, walk this way. We're going to start your ECT session today. Okay, just take a seat and lie down on this bed. So slowly down. Put your head back. There you are. Okay, we're going to start your program today, and let me just hook you up to the ECT monitor.
As Dr. Brott performs the ECT, she must first anesthetize Tina and administer a muscle relaxant.
Okay.
These will prevent Tina from feeling any pain during the procedure. Dr. Brott then attaches 2 electrodes to Tina's temples. An electric current will pass through these electrodes and into Tina's brain, causing a very brief seizure. Doctors do not know why the seizure helps reduce the symptoms of schizophrenia, but many studies have shown that patients who receive regular ECT treatments can make a dramatic improvement in their lifestyle. When Tina wakes up in an hour or 2, she will not remember the procedure. Her muscles will be slightly sore, but she should not experience any other side effects.
Hi Tina, how are you today?
Good.
Good? Okay, how have you been feeling lately?
Better.
Better? Have your movements gotten, you're not so stiff anymore? Yeah, so you're improving, you think so? Okay, so those regular ECT sessions have been going good, you've been feeling better, not so stuck in the same movements and negative symptoms. Okay, well you're not progressing as fast as I would like you to be. You're a little bit more responsive, which is good, but I want to see if there's any like family dynamic things that might be going on that's preventing you from moving forward and reducing all of those negative symptoms. So I would like to come and observe your family life tomorrow and see if maybe interactions between family members is preventing you or making you relapse in those negative symptoms. Would that be alright? Okay, well I'll see you tomorrow. Okay, so I'm going to be your sister's therapist today, and I'm just going to observe how you act. So just act completely normal.
Why are you always like this? You look so weird. You gotta move your arms. Come on. Stop flailing. You're not a bird. You can't fly. So weird. I hate you.
Tina, come on, we have to go. We're going to be late. Come on, we have to go. Tina! Tina! We have to go! Tina, we're going to be late. Ugh, I'll just leave you.
Okay, from my observations, I found that this family is very dysfunctional, and the way that you treat Tina is affecting the way she handles her disorders and what symptoms she expresses. Jake, you need to treat your sister with more respect and be more considerate of her condition. So instead of making fun of her, ask her things kindly and don't point out and make fun of her strange actions because she can't help it. So instead of try making conversations with her that don't involve like pointing out what she does wrong or what she does weirdly. And Hannah, there are always ways to get her to do things that don't involve screaming. The more pressure that you put on her, the less likely that she will comply with what you're asking her. So instead of screaming at her, try and ask her kindly and softly instead of using high volumes. Although your sister is improving, family stress is also causing her symptoms to relapse. So if you want your sister to start developing like normal behaviors and go back to how she was earlier, you need to start treating her more kindly, and that'll help.
2 years have passed since Tina began treatment for her catatonic schizophrenia. Her condition has improved greatly, and nearly all of her symptoms are under control due to therapy and her improved home environment. She continues ECT once a month and remains on a low dose of clozapine. Dr. Brott also began working with Tina through cognitive behavioral therapy. She has helped Tina understand that the delusions caused by her schizophrenia are not real, and as a result, Tina can function at a near normal level again.
Well, you ready?
Yes!
Move your arms.
I want to see you move your arms. Why don't you move your arms?
Okay, crazy.
Down, Tina.
And just act like I'm not here. I'm just gonna observe you.
Why are you always like this? You look so weird. I don't know what to do.
Go.
From what I have observed, this family is very
Go.
Go.
Wait.
Go.
So from what I observed, this family is very dysfunctional, and your actions are affecting the way Tina handles her.
The way Tina responds to her stimulus.
I'm sorry.
The words and sounds that I made over and over. This is called echolalia. From what I've seen, I believe that she might have catatonic schizophrenia, so we can try a type of drug therapy, and I think that might be working. That might.